Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
I'm John Strum, and this is RealTalk MS. It's February 19th, and we have a lot to talk about. This week, my guest on the podcast is Barry Talenti, the Executive Vice President of Advocacy for the National MS Society. Over the past year, we've seen our access to affordable quality health care come under unprecedented attack. We've seen a federal judge declare the Affordable Care Act to be unconstitutional. And we continue to see our access to affordable prescription medications, the medications that have been shown to delay the progression of MS and extend the quality of life for everyone living with MS. Well, that access remains threatened by the constant skyrocketing cost of those medications. That's why advocating on behalf of our own interests is so important to the MS community. The National MS Society is hosting its public policy conference in Washington, D.C. I'll be there along with about 300 other MS activists, and we'll be meeting with our members of Congress, raising their awareness about the challenges that go along with living with MS and discussing the legislative issues that are most important to people affected by MS. I'm recovering from oral surgery this week, so in a moment, we'll get right to my conversation with Barry about the policy issues that we're going to be emphasizing at this year's public policy conference and the difference that being an MS activist can make. If you're a regular RealTalk MS listener, then you already know how important I think it is for members of the MS community to advocate on our own behalf. Aside from influencing legislation that impacts people affected by MS on a statewide or even national level, the act of advocacy itself is incredibly empowering. That's why I'm especially pleased that my guest today is Barry Talenti. Barry is the Executive Vice President of Advocacy for the National MS Society. And Barry and I get to have what's becoming an annual conversation as we approach the National MS Society's Public Policy Conference, which takes place this year on March 3rd, 4th, and 5th in Washington, D.C. So I'm especially pleased to say welcome back to the podcast, Barry.
Well, thanks so much, John, and thanks for having me to have this important conversation.
Well, since we talked last year, I'm happy to report that RealTalk MS has gained a bunch of additional listeners, and it's a pretty big bunch of additional listeners. So for the benefit of everyone who wasn't with us when we did this a year ago, can you tell us a little bit about what the Public Policy Conference is and what actually happens there?
Sure. So we think about the Public Policy Conference as a cornerstone of our advocacy work at the National MS Society. It's almost like a kickoff for the entire year. So the Public Policy Conference is an important strategy that we have to build relationships with members of Congress, to educate activists, and of course, to urge members of Congress to take action on issues that are important to people with MS. But I said it's a kickoff almost to our year, and that's because the Public Policy Conference is just that one point in time. And what we know is that it's incredibly important for people to continue to stay engaged throughout the year, to continue that outreach and connection to their legislative offices, and to keep raising awareness and sounding the bell about what it's like to live with MS and the policy solutions that they need members of Congress to do for them.
So this year, we have an advocacy win to celebrate, and that's funding for the National Neurological Conditions Surveillance System. Can you talk a little bit about the importance of that program, what it's designed to do, and maybe explain how the National MS Society's advocacy efforts helped Congress find the funding to get this program finally launched?
Well, I would love to highlight that success. So as one of my colleagues on the health policy research team likes to remind me, this success has been more than a dozen years in the making. So it speaks to sort of the power of persistence and the need to continually make sure we're asking for what it is that people with MS need. So the National Neurological Conditions Surveillance System is going to be run out of the Centers for Disease Control, called the CDC. And the surveillance system will really be able to take a look at information that's out there, largely in medical and health data records, around people with neurological conditions. And that will help us better understand a lot of key demographic information about people with MS in our case, and could provide some baseline information for helping to understand some trends that we may see in MS. And while it's called the National Neurological Conditions Surveillance System, so it applies to all neurological conditions, the MS Society helped to lead this effort with the Michael J. Fox Foundation, and the CDC will start looking and building this system around Parkinson's and MS. So the National Neurological Conditions Surveillance System was authorized or created in legislation called the 21st Century Cures Act back in 2016. And that 21st Century Cures Act was a large piece of legislation that included a lot of different aspects to help discover and deliver research and treatments to people with all kinds of diseases and illnesses in the United States. And the National Neurological Conditions Surveillance System was authorized in that piece of legislation, but wasn't funded. So we kept going back and reminding Congress that they thought this was a good idea because they already created it, and now it was time to fund it. And so I'm pleased to say that last year it was funded, and the program is now kicking off at the CDC. And we look forward to the information that we'll be able to glean from the National Neurological Conditions Surveillance System and how that will help researchers continue to unlock answers for people with MS.
That's a great example and a great win for how the constant effort in advocacy over a long period of time sometimes really does deliver the kinds of outcomes that can start to support the needs of the MS community. So what are the priority issues that MS activists will be talking about with our legislators during this year's Day on the Hill?
So we think about our issue areas in three buckets for our Day on the Hill. So the first is related to research. We want to make sure that there's funding for MS research so we can find those scientific answers that we need. We also have a second bucket area that's around access to high quality and affordable health coverage. And that's really critical so people can actually get the health care that they need to live their best lives. And our third bucket area is around access to medications. So within these different buckets, we have a few different issues that we'll be advocating for. So I'll start with research. And those who have been engaged with advocacy before with the National MS Society know that we are a key advocate organization for the MS research program, which is research funding through the Department of Defense. And the Society helped to create this line of research funding. And since that time, it has funded more than $50 million in MS research. This program has to be appropriated or funded by Congress each year. So it's incredibly important that every year we are back reminding Congress about the importance of this program and urging them to keep funding it. And so that will be one of the issues that we talk about in MS research. We'll also be talking about funding for the National Institutes of Health, which really is the cornerstone of funding basic science and helping everyone to really understand those basic science principles that are then sort of taken and built on by other funders and sometimes by pharmaceutical companies. So we want to make sure to continue to fund NIH, as it's called, at the appropriate levels, and every chance we get to increase that funding a little bit to really make sure that we're able to find answers for people. And then this year, we'll have a third issue under this research bucket, This one's a little different, and it's to reauthorize a program that's referred to as PCORI, which stands for the Patient-Centered Outcomes Research Institute. And PCORI was authorized and funded a few years ago, and it's up for reauthorization in 2019. As I said, this one's a little different. This is research into comparative effectiveness. So it's really looking at comparing one treatment to another and looking at different strategies. So you can think about it as either answers that actually translate to the clinic. So what are those things that your healthcare provider can actually recommend that you do, or figure out which medication is best for you based on this type of research? PCORI has done a lot of funding in MS, about $69 million to date.
That's quite an impressive bucket. And I guess I would want to make the point that people may not see clearly that NIH, through their grant-making capabilities, frequently funds a research that ends up becoming a new treatment, a new disease-modifying therapy, something new to help people with MS live their best possible lives. So we see that at the end of the long process of actually getting medication approved.
That's right, John. And we know that many researchers move between the different sources of funding, depending on where they are in both their career and in their discovery process of the research that they're working on. So they may get early funding from NIH, or they may get funding from the MS research program for an innovative idea, sort of a proof of concept, and then be able to build on that with NIH funding down the road.
I know that typically the National MS Society funds dozens of those early stage pilot programs looking for proof of concepts so that these researchers can go on in their work and receive larger amounts of funding from larger institutions to bring some of those brand new ideas all the way through to fruition.
That's right. And this year, one of the researchers who will join us during the Public Policy Conference has received funding from the National MS Society, from NIH, from the MS research program at the Department of Defense, and from PCORI. So you can really see how each of the different institutes and agencies, including the National MS Society, has a critical role in funding different kinds of research.
You know, when I introduced you, I mentioned that I find advocating on behalf of your own needs and the needs of others affected by MS to be just an incredibly empowering experience. What do you see as the takeaway for the attendees at this year's Public Policy Conference?
Well, I think that is one of the primary takeaways. You know, we hope that people ordinary experience when they come to the conference and really want to stay engaged with advocacy throughout the year. So we want to make sure that they're building relationships with their elected officials, and they continue to keep in contact with their elected officials throughout the year, that people feel empowered to raise their own voice, to speak on behalf of themselves and others with MS, to really say, hey, this is a problem for me, and you're my member of Congress, and I need you to help find solutions. So really giving people sort of that avenue to shine a light on the challenges that they have and to really be part of creating change.
You know, I think some of what you just said is so important for people to really clearly understand, and that is that advocacy is not about what happens in Washington, D.C. Very effective advocacy happens in our own backyards all the time. People who are representing us in Congress are home for district visits when they're available in their local offices. They have staff available in their local offices who are there to listen to the concerns of their constituents, to the issues that their constituents face every day. There are letters to the editor that can be written on behalf of getting greater access to medication and access to quality healthcare coverage. These are things that people can advocate for those things, whether they're in Washington, D.C. or anywhere else in the country. Advocacy really is a 12-month kind of opportunity to let your voice be heard. Absolutely.
And so, John, you mentioned our access to healthcare issues. So let me touch really briefly on those. So under our access to high quality, affordable health coverage bucket, we have one issue that we'll be talking about, and it's gotten a lot of media attention lately, so you may have heard about it, but it's called surprise billing, or sometimes referred to as balanced billing. And this is when an individual winds up at what they think is a facility that's covered by their health insurance, only to find out later that a particular provider that they saw was not actually in network for them, but is out of network, or maybe someone wound up being taken to a hospital by ambulance and had little say, or no say, really, over what facility they went to, only to later find out, again, that that facility was out of network. And what happens is people get these surprise big bills in the mail telling them how much money, often to the extreme, that they owe to different healthcare providers or facilities for the care they got, when all along they thought that they were getting care at a facility that was covered by their health insurance, or again, they had no say over where they were able to get that care. There's been a lot of attention to this troubling issue, and that's one of the things that we'll be advocating on at the Public Policy Conference this year. And then, John, you and I have talked quite a bit in the past about our access to medications work, and we're going to continue our comprehensive approach to finding solutions. We know that there's not one single solution that's going to solve all of the challenges that we see for people who really rely on these life-changing medications. So this year, we're going to focus on removing barriers to generics coming to market. We're also going to talk about reining in those high price increases that we've seen year over year. And finally, we're going to advocate for improving the benefit design in the Medicare prescription drug benefit to make sure that people can afford their disease-modifying treatment.
That's terrific. You're right. This is a topic you and I have discussed previously, and I'm certainly going to keep talking about it until we see the sorts of resolutions that will really provide some real support and aid to the people who need it most. I recognized what an issue this is when I watched the recent State of the Union address. I know that Senator Tammy Baldwin of Wisconsin actually brought one of her constituents to the State of the Union address, and this was someone who is living with multiple sclerosis and has a very significant issue in terms of accessing affordable medication. So I know it's a topic that has received lots of media attention. It's certainly gotten the attention in Congress, and I'm glad that's something we're going to be talking about on the Hill.
Absolutely. And Diane has a really powerful story that she's willing to share with people. And, I think it's important for your listeners to know how Diane became such a strong advocate around access to medications. It was just a few years ago, Diane was transitioning into Medicare, and she started to look at her different options for a prescription drug benefit and realized that she would be paying more than $7,000 a year out of pocket for a medication that she had been on for more than 20 years. So Diane and her husband Lee were really quite astonished at the price increases on that particular medication that she'd been on for 20 years and what her out-of-pocket costs would be. And so one day I got an email from them asking questions about it and expressing their very fair outrage over the situation that they found themselves in. And from that single outreach of an email wanting to know more, I was able to say, look, we don't have solutions right now, but we're working to find solutions, and will you join us in doing that? And Diane and Lee said, absolutely, and they've been to the Public Policy Conference since then, and that's where Diane really started to build that relationship with Senator Baldwin. And on one of those visits, Senator Baldwin remembered Diane's story and how impactful it was, and that continued the relationship to Senator Baldwin inviting Diane to join her at the State of the Union.
I think this would be a perfect moment for us to kind of restate that invitation to join us as an MS activist. If someone who's listening to our conversation today wants to take the next step and get involved, where should they go? What can they do?
Right. So we know not everyone can join us in DC at the Public Policy Conference, but there is still a lot that you can do from home to amplify our voices in DC and to raise your own voice. So follow us on various social media channels of the Society, Facebook, Twitter, Instagram, and you'll see what we're doing at the Public Policy Conference. You can also join the MS Activist Network, and you can find that on the Society's website under the Get Involved and Advocacy section. Look for some Take Action buttons. And if you're part of the MS Activist Network, you'll receive an action alert that day urging you to reach out to your elected officials and share the issues that we'll be talking about in DC on Capitol Hill. So you can do that from home and amplify our voices.
I'd much rather be part of the solution than sitting on the sideline. So I hope everybody goes to the Society website, click on Get Involved, check out Advocacy, and start receiving those action alerts, start receiving the social media tweets and Facebook posts so that you can not only follow along, but more importantly, be involved in advocating on your own behalf. I just think that, as I said, is so personally rewarding, and it's just doing more good. So I hope everybody listening will take a little advice from someone who got this message a few years ago and is speaking truly from the heart, from my own experience. Barry, I'm really looking forward to spending time with you and all of the MS activists at the Public Policy Conference. It gets underway March 3rd in Washington. And I want to thank you and your entire team for what I know is an enormous effort that goes into making the Public Policy Conference such a huge success, and the ongoing advocacy efforts that we don't get to see as quite as visibly, but are happening every single day on behalf of people affected by MS. And finally, thanks for finding a few minutes to talk with me today.
Well, thanks, John. We look forward to seeing you in DC in a couple of weeks, and we hope that everyone joins us on March 5th to amplify the voices of people with MS.
Well, that's going to wrap up this episode of Real Talk MS. If you haven't yet, I invite you to visit the Apple App Store or the Google Play Store and download the free Real Talk MS app for your iOS or Android smartphone or device. It's the easiest way for you to stay connected to the podcast. You'll never miss an episode, and the app allows me to share all sorts of bonus content with you in the weeks and months to come. My name is John Strum. Thanks for listening, and we'll catch you next time.